All right, I recorded this a year ago, but it's such a good story that I need to tell this. This is a patient, she's a dentist, she's a dental student, and she's progressively having trouble with school, but she's also having trouble with motor. She can't move her legs well. She goes to see an orthopedic surgeon. Now, I have many patients like this who see orthopedics first and then they realize that it's not the leg or the arm or it's not an orthopedic problem. In the absence of pain, if there's no pain in the joint, it's rarely, in my opinion, the orthopedic issue. You have to think about neuro. You have to think about the brain. You have to think about something neurologic. And in her case, she's starting to have trouble with school, but that could just be stress. But she's having trouble walking. She's using a walker. She's using a cane, a wheelchair, and this goes on for 2 years. She doesn't improve. Finally, an astute orthopedic surgeon says, this is not right. This doesn't fit. You're not improving. We need to get an MRI. They do an MRI of the entire neuroaxis and they find a benign problem. Now, this is a piece of trapped skin. During embryology, we can trap this little piece of skin and then this can grow inside the brain and just start putting pressure. Fortunately, it's not a tumor. It's not a cancer. It doesn't spread, and I can relieve this and remove it. And I do so during the middle of the COVID pandemic when we're all in lockdown. Why don't we listen to her story? Well, hello, Dr. Lee. I'm here with Samrita Sharma, who I operated on many years ago, actually, during the COVID. Yeah, it was during COVID pandemic. And she's a dentist, but she had very dramatic symptoms. And so I'm going to let her tell her story.
Well, my name is Samrita Sharma. I was a student. I was doing my DMD at UPenn, at this university only. My first semester was really good. Everything was like normal. Grades were good. Then it started. Dentistry is like an amalgamation of your hand and eye coordination, right? So my work was getting affected a lot. I was not able to do the procedures like I'm supposed to do. Then one day I also injured my leg. And I went to the ER and they said like, oh, you'll be fine. Like it's just a sprain and you'll be fine in 2 weeks. But that 2 weeks never came. It's became 2 years. I had a wheelchair. It was actually on and off. I was in a wheelchair for 2 weeks. Then it became a cane. I was still enrolled. 2 years went by and I was still in the cane. Sometimes I get better. Sometimes I can walk. Sometimes I'm in cane. Sometimes I'm in wheelchair. That's how I do school. Obviously, I kind of, was struggling very, very badly in school. And then COVID happened. And that's when, and one of the orthopedic who was seeing me for so I was going from one doctor to the other. And everyone was saying like, okay, do this physical therapy, do that. But no one said about neuro. And the last orthopedic, when COVID was going on, he said, and that time it was like virtual appointment. But he said, like, no, I don't think it's orthopedic. It's been 2 years. You're not improving. And also by that time, by COVID, I had a lot of other symptoms. My vision was completely gone. I used to have a lot of tremors, hand and head, jerk movements and stuff. And obviously, I couldn't, mobility was kind of nil. So listening to all this, he said, then go to neuro. But that time was COVID. So they were not seeing patients unless you were dying. So I got Dr. Lee's appointment I think 3 months out or something. So in July, that's when I came and see Dr. Lee. But it was really dramatic because I still had my boards to pass. Otherwise, I couldn't finish school. So Dr. Lee, I gave my boards, I remember. And the next day, I gave boards, 21st August, I think. I had my MRI and I was immediately admitted to the hospital. So the day after boards, and then in 3 days, Dr. Lee then did surgery. But again, he saved me. He changed my life. But it was just so painful and dramatic. The 2 years I lost 2.5 years, and not only that, I actually lost 3.5 because after that recovery took 1.5 year almost. I was in the rehab for almost a month. But then the physical therapy, the occupational therapy, the vision, the speech therapy, everything kind of took almost 1.5 years. Yeah.
So, did you have much headache?
No, I never had a headache. It was all, and then it was physical because I couldn't walk. But then the last symptoms were, I think, vision, speech, and
And then you never broke anything in your leg.
No, they did MRI in my leg, and they said it's only it's just sprain. You don't need surgery.
That is really interesting because basically this tumor is pressing on your brainstem and it's affecting all these things,
Yeah.
but you keep seeing only orthopedics because
And no one, it was, I mean, I'm so glad to the last orthopedic from Penn who finally sent me. But by that time, to be honest, I also knew something was wrong because it's been like 2 years, and then I'm having speech issues. But of course, you don't expect you'll have a brain tumor.
Right.
No one expects that. But I knew something was wrong with me. So when he said that go to a neuro, I was like actually happy that okay, maybe something else will happen. There'll be an end to all this. And because the way I gave my boards, vision was really bad. I mean, I couldn't see. Like I had to read the X-rays in the boards, right? And I had to like that time I used to see all double vision or like blurry vision. So I had to close my eyes, one eye, and that's how I read the X-rays, and that's how I don't know. God was there with me. I passed the boards, and I'm a full-fledged dentist. So God was definitely helping me out.
Wow.
I didn't think I'll pass like that, to be honest.
So by the time we did the surgery, you were very happy to do the surgery.
Yeah, I was very happy. And I honestly thought when you did surgery, when I woke up, oh wow, I'll be like a new person. But little did I know it doesn't work like that.
Yeah, I also was hoping that you would recover faster than the 1.5 years because your tumor actually is literally trapped skin.
Yeah.
So,
epidermoid.
Right. So it's just a piece of trapped skin from when you're a fetus. And yet it just takes time because I think your brain stem had been so squished and so compressed for so long.
Yeah, it took, I mean, even if now, like I said, if you look at me, you won't think anything is wrong. But yes, even now I know there are little nuances in my body. Like I can't run or like I can't dance like before. Stuff like that. I'm a little wobbly at times. But yes, otherwise, like you saved my life. You changed my life.
But even during your recovery, you were able to have a baby.
Yeah. No, baby was after that. I mean, after I got discharged, the next thing. But yeah, even that is a miracle. I never thought I can have a baby ever after all this. Even. But I don't know how that happened. That's a miracle too.
Yeah. So, I don't know what kind of advice we can give because if you're studying for boards and your body is not responding the way it's supposed to, maybe think about the brain, I guess. Pretty...
Definitely. No, I know, yes, 100%. I also think I think we should not ignore this kind of stuff because there was a huge, large amount of time I kept thinking, I'm not doing good in school. There must be something wrong with me. Mm-hmm. I have to be more focused. I'm not doing the job properly. I have to study more. And like that, I spent a long amount of time questioning me. Like, it's me. But I never thought, okay, there can be something else also. So when something else is wrong, when your grades are falling, or whatever, you're having some challenges in life, you have to think in the bigger box. That's what I learned from
That's actually very interesting because you were at the top, one of the top dental schools in America, UPenn, and this is happening. So you start questioning yourself.
Yeah,
wow.
and exactly, and I started questioning And in the beginning, I was so happy. Oh, I got into UPenn, but then in school, when these things happened, everything was like, oh, it must be me. And actually, I think the surrounding also happened because school is hard, right? It's very hard. Oh. So everyone when you start questioning yourself, I think everyone starts questioning yourself.
Yeah.
So you gotta put your guard down.
Yeah. But it's great. You did mention that you can't run and can't dance like you used to.
Yeah, definitely. I mean, now it's like 2024 today. Today's what, 6th of May, right? Yeah. 24. Yeah, it's been like 4 years, but still, I cannot run, or I cannot walk on ice, or I can dance little bit here and there, but obviously not like before. I used to be I like dance was my passion, and I used to dance a lot in the beginning, like before all this happened. But now obviously I can't. Like, but yes, but I'm happy. I got my life, and I'm doing everything. I'm doing full fledged. I'm working. I'm managing my baby, and yeah, I'm having a normal life, which is what I wanted for a long, long time.
Great.
That's thanks to you.
Yeah, no, I remember you sitting in the wheelchair, and it was so dramatic because it was also during the COVID
Yeah.
pandemic, so we didn't operate a lot. So your surgery was very memorable.
Yeah.
And all right, well, I look forward to. We're following this tiny little thing because it's hard to cure epidermoids, but we just wash this little piece of skin, and it's going to take many decades, I think, before it ever becomes a problem. So
We'll
very
follow
good.
every year.
Yeah.
Okay.
All right, very good.